I think we're fortunate in prostate cancer to have PSA and now with ultrasensitive PSA tests as well that lower the lower limit of quantitation for PSA in the blood. So PSA is really an extremely well-performing biomarker. However, of course, it can be elevated in many conditions that are not prostate cancer. So it can be elevated, for example, in men with prostatitis. And so while I think it is in general a good biomarker, it's not a extremely specific biomarker, again, because it can be elevated in these non-cancerous conditions. And so, I think I am not personally aware of current biomarkers in current clinical use that are better performing than PSA in prostate cancer. And but I think what we and many other groups are interested in doing is finding subpopulations of men, perhaps those at high risk, in whom the PSA test is more specific for prostate cancer. So if you apply PSA screening in a population of men that are, a much higher baseline risk or have other clinical signs that they may be at a higher kind of baseline risk of prostate cancer, then PSA as a screening test is likely to be better performing and more specific in that population. And so, for example, there is a lot of interest in using genetic risk. So there are some emerging somatic genetic panels that can produce essentially what's called a polygenic risk score, which is essentially a kind of genetic risk of developing prostate cancer over a man's life. And there's some interest in using that and other clinical features to try and predict which men in the general population are at a higher risk of developing prostate cancer in their life, and therefore in whom PSA tests may be better performing and in terms of sensitivity and specificity, as well as just having a higher therapeutic index or a higher benefit to risk ratio in those higher risk men. So I think it's, in summary, PSA is the best that we have for now, but I think there's a lot of really exciting work going on in terms of finding groups of high risk men in whom PSA may be even better performing and who may therefore benefit even more from PSA screening than the general population.